Hey guys, this is Dr. Samir Islam, and today I'm going to talk about a very confusing problem that a lot of patients have when they come see me. And they confuse the differences between IBS and IBD. In this video today, I want to talk to you about what those differences are and how that can be important for you. And when you have IBS is defined as irritable bowel syndrome. This is very different from IBD, which is inflammatory bowel disease. And this consists of either Crohn's disease or ulcerative colitis. Now in this video I want to talk about three main differences that you may have when it comes to IBS and IBD and how they may be different. And knowing these three main differences will help you know exactly what you may have, which in turn can help out with the treatment options we can offer for you. Now the first major difference between IBS and IBD is the fact that IBS is a functional problem. What that means is that there are no abnormalities on blood test, imaging, and there's nothing that we can see on scopes to let us know that you have IBS. And so this is a diagnosis that typically does not have a particular cause that we can identify. This is very different from IBD or inflammatory bowel disease, in which there is a structural problem occurring within the GI tract. There's something that we see on endoscopy, there are abnormalities on blood tests, and there also may be changes on imaging that we can see. And with IBD, you actually have changes within the lining of the GI tract, whether it's ulcerations, narrowings, or strictures that occur. The second most common cause or differences between IBS and IBD is how we diagnose that. Now with IBS, there's no one diagnostic test to let us know that you have IBS. In fact, most of the testing will be normal, whether it's blood tests, endoscopies, or imaging. And so usually IBS is a clinical diagnosis, meaning it's made based on symptoms or what you tell us whenever you first discuss with us. And we may do other tests to help support or exclude other conditions that we think could be going on. When you have IBD or inflammatory bowel disease, there are tests that can help us know if you actually have this, whether it is blood tests or endoscopies or imaging, or all three of the above. And so there are things that we can do to help diagnose IBD. The third main difference is how we treat these conditions. So with IBS or irritable bowel syndrome, there are a lot of different ways that we can treat this, and it can change and depending on the particular symptoms the patient may have. It could be lifestyle things that we can do. It could be dietary changes that we can make. It could be medications that we put you on, or all three. And so the good thing about IBS is that there's no one universal treatment. And so a lot of it depends on what we do. And for a lot of patients who have IBS, they may not want treatment. That's perfectly fine. Now, when you have IBD or inflammatory bowel disease, unfortunately, there are things that we have to do for these patients. And more often than not, we have to give you medications to help control the inflammation, because if we don't, there's a very good chance that these conditions can worsen and cause severe complications, including cancer in the future. So more often than not, we have to give medical treatment. Now, we could do lifestyle things or dietary things on top of that, but the first line treatment typically is medical treatment when you have IBD. So even though one simple letter can mean the difference between IBS and IBD, there's a wide change in terms of the implications and treatment options that we have for our patients. And so I hope this video helps you to explain what made the differences are when you have IBS or irritable bowel syndrome versus IBD or inflammatory bowel disease. I want to thank you guys for watching this video. I would encourage you to subscribe to my YouTube channel or sign up for my newsletter or like my Facebook page. Thanks and take care.